Hello friends, welcome to SERUMMEDICO. In this video, we are going to discuss about ECG. There are 5 rules of ECG. It includes waves, ECG paper and heart rate, electrodes and its principle, placement of the ECG, and rhythm of the heart. If you know all these 5 rules, and you can easily diagnose the heart condition. And in this video, we are going to discuss about all these 5 rules. In the next video, you can discuss about some of the diagnosis and arrhythmia. So we can go in detail. And this is a small paper which shows the entire ECG. You can take a screenshot of it and watch the full video so that you will understand what is in this paper. First we can discuss about the waves. First, what is ECG? It is nothing but it's the electrophysiological events that is taking place in the heart. We can record in the ECG. Before going in detail, please watch the physiology of heart video which I have been uploaded, and I have given the link in the description. Please watch it, then you can understand in detail. First, there is a small rule. What does that rule means? How the depolarization of the heart occurs. First, the pacemaker of the heart get depolarized. That is SA node. SA node first depolarize, then the atrium, then the AV node and bundle office, then the ventricle get depolarized, and then the ventricle get repolarized. This is the rule. Okay, first when the SA node get depolarized, there will be no much cardiac electrical activity, so the waves cannot be recorded, so there will be no waves for SA node depolarization. Then the atrium gets depolarized, so the first wave which will be seen in the ECG is its P wave. The P wave indicates the atrium depolarization. Then AV node and bundle office get depolarized. That is the P wave QR. This PR segment is the AV node and bundle office. Then the ventricle depolarize, which includes P is atrial depolarization, and QRS. This is the QRS is the ventricular depolarization. Then ventricular repolarization. Ventricular repolarization indicates P is atrial depolarization, PR is AV node and bundle office, and QRS is ventricular depolarization, and ST segment represent ventricular repolarization. So the P wave is atrial depolarization, PR is a bundle office and AV node, then QRS is ventricular depolarization, and ST segment is ventricular repolarization. This is the first rule you have to know about it, so keep in mind. Then we can discuss about the ECG paper and the heart rate. If you see an ECG paper, there will be many small boxes. Just take a small box of it, and it has 5 millimeter. It will be 5 millimeter. The small box is 5 millimeter in length, and the ECG paper runs at a speed of 25 millimeter per second. At 1 second, 25 millimeter will be run. So for 1 millimeter, 0.04 second. For 1 millimeter, 0.04 second. Then we can discuss about the heart rate. How to find the heart rate? That is a small formula. 1500 by RR interval. You know, this is P wave, Q wave, R wave. P wave is atrial depolarization, PR is bundle office and AV node, and QRS is ventricular depolarization, ST is ventricular repolarization. The interval between the RR is, you have to calculate in millimeter, how much millimeter are there. Okay, this is a formula you have to keep in mind. 1500 by RR interval. Normally the RR interval will be 25 millimeter. So if for example, if the heart rate is 20, so 1500, sorry, if the RR interval is 20 millimeter, 1500 divided by 20 will be 75. So the heart rate is 75 per minute. If the RR interval is 30, then it is 50 per minute. So this indicates if the RR interval is less than 25 millimeter, then it indicates tachycardia. If the RR interval is more than 25 millimeter, it indicates bradycardia. So this is the formula to calculate the heart rate. Then we can discuss about the electrodes and the principle. Before going in detail, there is a small physics everybody will know about galvanometer. You have studied in the 12th standard of physics. Galvanometer. The galvanometer is positive electrode and negative electrode, and normally the plane of field will be moving from the negative to positive. The same physics is applied here. So what is the principle of galvanometer is the electrical difference between the two planes. So consider it 2 points, A point and B point. If A point is positive pole, it is considered as exploring electrode. If B point is considered as negative pole, it is considered as reference electrode. Just for a consideration, that's all. And normally the plane of field will be moving from negative to positive. Negative to positive. This is basic principle. Then there are 5 principles. Okay, consider this is a galvanometer. A is negative, B is positive. So normally A from negative to positive, A to B, the plane of field will be there. So if the electrical activity in the heart also moves in the same direction, then there will be a positive deflection in the ECG. Then there will be a positive deflection. This is positive deflection in ECG, and it is parallel. Then if the plane of then if the electrical cardiac activity is just oblique to the plane of galvanometer, then will be some positive deflection. This you can see, this is maximum deflection, this is some positive deflection with this oblique. Then if the plane of the electrical cardiac activity is just perpendicular to it, there will be no deflection at all. There will be no deflection. And if the plane of field is just opposite to it, if the positive deflection in the heart is moving in opposite direction, then there will be negative deflection. If the negative ions are moving in opposite direction towards the negative ion is moving towards the negative, then there will be maximum positive deflection. Okay, when the electrical activity is just parallel to it, there will be positive deflection. When it is oblique, some positive deflection. When it is perpendicular, there will be no deflection at all. And if the positive ion is moving towards the negative side, there will be maximum negative deflection. If the negative ion is moving towards the negative side, there will be maximum positive deflection. This is the basic principle. Then everybody have know that depolarization occurs from endocardium to epicardium. Endo to epi, depolarization will be occurring. So the positive ions are moving to the positive, so there will be maximum positive deflection. In repolarization, from epi to endo occurs. So there will this is repolarization. And there are two rules. If there is a normal depolarization of the ventricles, then the QRS, the ventricle depolarization QRS, and the T wave will be in same direction. If there is an abnormal depolarization, then the QRS and the ST will be in opposite direction. If you see an ECG paper, if there is if the QRS and ST are in same direction, then it is a normal depolarization, normal event occurring in the heart. If the QRS and T wave are in an opposite direction, then there is some abnormality in the heart. Okay, then we can see about the placement of ECG. In the placement of ECG, there are two activities. One is vertical activity of the heart. If consider this is a heart, then there will be vertical activity of the heart and horizontal activity of the heart. For a vertical activity of the heart, we can consider as we can use the limb leads. There are two types, unipolar and bipolar. In unipolar, the lead named are AVR, it indicates right arm, AVL left arm, AVF foot, and bipolar 1, 2 and 3. For horizontal activity, use chest leads. They are unipolar only, V1, V2, V3, V4, we are placing in the chest. Then we can first discuss about the bipolar leads. This is a small triangle which is very important, we have to keep in mind. This is right arm, right upper limb, left upper limb, and this is left lower limb. Okay, the right upper limb negative and the left upper limb is positive, and the left lower limb is positive. This is a small triangle, and this is lead 1 connecting right upper limb and left upper limb, and the lead 2 is connecting right upper limb and left lower limb, and the lead 3 is connecting left upper limb and left lower limb. This is the important triangle you have to know. This is the nth one triangle. Then we can discuss about detail. if the lead one connecting the right upper limb and the left upper limb. Right upper limb negative, left upper limb is positive. If the normally the depolarization from the SC node occurs to the atrium in this direction. So you can see the line is just oblique to it. When there is an oblique, then there will be some positive deflection. Some positive deflection in lead 1 P wave atrial depolarization. From SI node to atrium, depolarization occurs and the line is just oblique to it. And this is the rule we have studied here. If there is oblique, then there will be some positive deflection. So in lead 1, there will be some positive deflection of P wave. Then and the lead 2 right upper limb and left lower limb, and the is from the SI node atrial get depolarizes in this direction. It is just a parallel. If there is parallel, there will be some maximum deflection. This is minimum. This is little bit some it will be higher than this lead 1 P wave. Then lead 3. Lead 3 is connecting left upper limb and left lower limb, and this is the line, and the SI node gets depolarizes in this direction. You can see it is also just oblique to it, and there will be some positive deflection. So these are the lead 1, lead 2 and lead 3. Then so from this you can understand in lead 2 there will be maximum deflection in P wave. So if you want to find any abnormality of the P wave or any pathology in the atrial depolarization, you can use lead 2. Keep in mind, we will be discussing this about in the next video. So for any abnormality in the P wave, we use lead 2 because in lead 2 the P wave will having maximum positive deflection. The unipolar leads, I said AVR, AVL and AVF. In the AVR, but before going to unipolar limb plates, there's a small thing you have to know about it. What is unipolar limb plates are? Nothing but detects the electrical difference between one limb. For example, considered it is the right upper limb, between the electrical difference between the one limb and with other limb. With other there will be like left upper limb and left lower limb. The electrical difference between the one limb and other two limb. First we can consider it as AVR, right upper limb, and for this we have to take left upper limb and left lower limb as the reference electrode. So this is lead 3. This is lead 3. You have seen it before. Left upper limb and left lower limb is lead 3, and you considered in the left the right upper limb, the positive is connected to the right upper limb and the negative is connected to the left upper limb and left lower limb. So normally in a SA node will be depolarized in the atria in this direction, but the line of deflection here will be towards the positive. So towards this is positive, no, so the line of deflection will be towards this direction. So this is the line of deflection towards positive, and the SI node is depolarizing this direction. So it is parallel. When it is parallel, then it shows negative deflection, and it also indicates the lead 3 is just perpendicular to the AVR, and we can next we can discuss about the AVL. So in this AVL we have to take right upper limb and left lower limb in the exploring electrode. So this will be the line of electric field. This will be the line of electric field, and this will be the line of electric field for the AVL. So AVL is just perpendicular to lead. This is lead 2, just perpendicular to lead 2, and the SA node, what will the SA node will be? SA node will be depolarizing in this direction. So what will happen? And it is perpendicular. Perpendicular means there will be no deflection at all. So there will be no P wave. And next comes the AVF. In AVF, we have to take the left lower limb as the exploring and right upper limb and left lower upper limb as the reference electrode. So the line of electric field will be in this direction. So and this is lead 1. So AVF is perpendicular to lead 1, and there will and here some little positive PV will be seen. That's all. This is the unipolar LEDs. In unipolar LEDs, first you have to consider only one limb as an exploring electrode and consider other two limbs as an reference electrode. In AVR, right upper limb is an exploring electrode and left upper limb and left lower limb is an reference electrode. And the line of electric field will be in this direction, and the SC node will be depolarizing this direction. So if it is parallel, there will be negative deflection, and the AVR is perpendicular to lead 3. In AVL, left lower limb is the exploring electrode and right upper limb and left lower limb will be the reference electrode, and the line of electric field will be in this direction, and the lead 2 is just perpendicular to AVL, and the SC node will be depolarizing in this direction. So it is perpendicular. When it is perpendicular, there will be no deflection at all, no P wave. And in AVF, left lower limb is an exploring electrode and right upper limb and left upper limb will be an reference electrode, and the line of deflection will be in this direction. So lead 1, AVF is just perpendicular to lead 1, and there will be little positive deflection. This is an schematic representation. Consider this lead 1. So for lead 1, which is perpendicular? For lead 1, perpendicular is AVF. For lead 1, perpendicular is AVF. For lead 2, perpendicular is AVL. This is lead 2 and this is perpendicular line. AVL. For lead 3, perpendicular is AVR. Lead 3, AVR. This is a small it will be discussing about in detail in the next video regarding the deflection and the degree. Next come the chest LEDs, unipolar LEDs. Consider this as a sternum. This is 4th intercostal space, 5th intercostal space, and there are 6 LEDs. V1 will be placed in the right 4th intercostal space, and V2 in left 4th intercostal space, and V4 in left 5th intercostal space, and V3 is between V2 and V4, and V4 will be in mid clavicular line, V5 will be in anterior axillary line, and V6 will be in mid axillary line, and these LEDs will be connected to the corresponding right upper limb, left upper limb and left lower limb. This is the Wilson's central terminal. This will be known as Wilson's central terminal, and there's actually discussed in the first page of the video. SC node will be depolarizing first, then atrium, then AV node, bundle office, and ventricles. This is you have to remember this rule always. Next, the rhythm of the heart. The rhythm of the heart. Regarding the rhythm of the heart, first we have to keep in mind is how does the ventricle get depolarized. Normally, ventricular get depolarized by ventricular depolarization just controlled by the pacemaker of the heart, SA node. From the SA node, atrium, AV node, bundle office, and lastly ventricle get depolarized. So, if normally SC node will be depolarizing atrium, and atrium to AV node, bundle office, and then to ventricles. So, for atrium, PV will be seen, and for ventricles, QRS will be seen. So, this is a normal rhythm. Sinus rhythm is a normal rhythm. Normally rhythm. Atrium, SC node will be depolarizing atrium, PV will be seen, and then atrium to AV node, and AV node to ventricles. So, PQRS. If PQRS is in, it is a normal sinus rhythm. And regarding with the sinus rhythm, if the heart rate is 60 to 100, is a normal sinus rhythm, NSR. If heart rate is less than 60, then it will be sinus bradycardia. If heart rate is more than 100, it is sinus tachycardia. This is the rhythm, sinus rhythm, normal rhythm. If it is controlled by the pacemaker is SA node. Then there is other rhythm known as junctional rhythm. If the pacemaker is AV node, what will happen? The atria will not be depolarized. Only the ventricle will be depolarized. So, if the atria is not depolarized, there will be no P wave. only ventricles are depolarized, so only QRS will be seen. Only QRS will be seen, no P wave, because the AV node is controlling the ventricular depolarization, SA node is not functioning, so atria will not be depolarized, there will be no P wave, only QRS will be depolarizing, only the ventricle will be depolarizing, only QRS will be seen. This is junctional rhythm. Then idioventricular rhythm. In idioventricular rhythm, if the pacemaker is bundle of his, what will happen? The pacemaker is bundle of his, there after bundle of his there will be right and left branch. Right branch, left branch. Right branch will be going to right ventricle and left branch will be going to left ventricle. So the ventricle will be depolarizing only. But what will happen? The ventricles will not be simultaneously depolarized. It will be one ventricle will be depolarizing at one time, another ventricle will be depolarizing another time. So the QRS, so the depolarization time will be increased. So the QRS become wide. QRS become wide. This is the idioventricular rhythm. And another thing you have to keep in mind is if the and this is an abnormal depolarizing QRS. So I have said the rule in the on rule, if the ventricular depolarization is abnormal, the QRS and T wave will be in opposite direction. And if it is present in the ECG, it indicates idioventricular rhythm. And these are three types of rhythm, and I will explain. Regarding rhythm, first we have to keep in mind is ventricular depolarization. How the ventricle get depolarized? If the ventricle is depolarized from SC node, atria, AV node, and ventricles, for atrial depolarization, PV will be seen, ventricular depolarization, QRS will be seen. So it is a normal rhythm, normal sinus rhythm. The heart rate is less than 60, it is sinus bradycardia. More than 100, sinus tachycardia. And if the ventricular depolarization is controlled by the AV node, if ventricular depolarization is controlled by AV node, atria will not be depolarized. So if the atria is not depolarized, PV will not be seen. So only the QRS will be seen. And idioventricular rhythm, below the bundle of his, there will be right and left branch. For example, Purkinje fibers, right Purkinje fibers, left Purkinje fibers, and the ventricle will be depolarizing only, but the branches will be depolarizing the ventricles not simultaneously. It will be one ventricle will be depolarizing one time and another ventricle will be depolarizing another time, so the depolarization time will be increased, so the QRS will be wide. And one rule I have discussed before, if the ventricular depolarization is abnormal, then the QRS and TV will be in opposite direction. This is the idioventricular rhythm. That's all. Thank you for watching the video. In next video you can discuss about the abnormal conditions in ECG and arrhythmia.